My name's Jeremy Oryhon. I am a hip and knee joint replacement specialist. I've been in practice since 2009. My practice philosophy, I think, rests on 4 pillars: partnering, education, treatment plan execution, and recovery. I'm mostly seeing older patients with hip and knee arthritis. Older patients really just want pain relief and function return. I think education is important to go through the disease process and tell them the options available, and even clear up some misconceptions that I think are out there now. I think it's very important to partner with the patient and discuss those issues and really kind of redirect and refocus them on their particular disease and what can and can't be done for them. I find incredible joy and satisfaction in patients recovering from their hip and knee arthritic disease. It's not so much an inward joy, but an outward-facing joy to see the patients come in and be relieved of pain and functioning much better. I think it's an incredible honor and privilege to take the decades of medical and orthopedic knowledge and integrate that into my care.